Hi, I'm Dr. Nicole Byrne. I'm the Head of Speech Pathology at Recovery Station. Today, I'm just going to have a chat about some of the new NDIS standards that have come into play in December 2021. So these new NDIS standards refer to people with severe dysphagia and mealtime management plans. So the standards are targeting people who are providers of supports to people around mealtime management. So it might be people who are helping to prepare meals, cooking meals, setting meals up. And so it is providers that are using the support category 104, high intensity daily personal activities. So NDIS has provided us with a list of standards that providers will be required to show evidence that they comply with. How they will provide this evidence is not quite clear yet, so we're waiting for some further information to come from NDIS. So examples of some of these standard statements are around people who are providing those supports being trained in preparing safe meals, knowing the risks associated with someone having difficulty with eating and drinking, knowing when to refer someone for a swallowing assessment if they do have swallowing difficulties. So why is NDIS at the moment concerned with swallowing? Well, we're concerned all the time with people swallowing, but there has been a couple of specific inquiries recently that has heightened the awareness. So swallowing can cause a lot of impacts on someone's life. So medically, it can cause dehydration if they're not drinking enough, malnutrition if they're not eating enough. It can impact on the quality of their life. It can cause people to be frightened to eat and drink. We know that if people are having swallowing difficulties or dysphagia, they can have aspiration of food, fluid, or saliva or medication that can go into their lungs. So going down the wrong way, causing coughing sometimes. And if that liquid or food goes into the lungs and stays in the lungs and there's a bacterial component, they can end up with aspiration pneumonia. But also people can choke on food. So chunks of food can get stuck in their mouth, the back of their throat, or the top of their airways, and that can stop their breathing, and that can cause death. And so this consideration of obstruction has been one of the main drivers behind the implementation of these new standards. Obstruction or food getting stuck actually only has to happen once, and it can be potentially fatal. And so a number of inquiries have had a look at incidents where people have died and have found that people who have disabilities are overrepresented compared to people without disabilities when it comes to things like choking on food as a cause of death. Also, some recent inquiries, such as the disability inquiry in Victoria, has shown many instances where speech pathologists had recommended modified diets and these had not been followed, and that had placed someone at risk of death, or in some cases, it had actually caused someone to die. So the new standards from NDIS are actually a fantastic opportunity for us to ensure that everyone who's working with someone who does have dysphagia and a mealtime management plan in place, that they have the education and support that they need to successfully and correctly implement that mealtime management plan. So a mealtime management plan is developed by a speech pathologist. It's done in consultation with the person who has the swallowing difficulty, along with their family and anyone else who might be supporting them. So it might be support workers who are coming in and providing care. It may be care or nursing staff if they're in an aged care facility. Consultation with other allied health professionals is really important as part of that, and medical professionals to ensure that all the information in the mealtime management plan is consistent. So for example, if someone's on a diabetic diet or if they need adaptive cutlery, then we need to make sure that that is included in the mealtime management plan. So a speech pathologist making recommendations about a specific diet consistency or other recommendations about using different cutlery or a teaspoon versus a large tablespoon is not restrictive practice. And that's because we're making those recommendations around safety for medical and health reasons. So preventing someone from getting aspiration pneumonia, preventing someone from choking and dying. So at recovery station, we conduct an assessment, a swallowing assessment of someone who's been referred to us. We will get all of their background medical history. We'll conduct an oromusculature assessment. So we'll have a look at the anatomy, the physiology, see how their nerves and muscles are working, their mouth, their lips and their tongue. We will be asking about what food and fluid they're currently having and whether they're having difficulties with specific things. We'll observe them eating food and fluid. We might have some different food trials that we'll undertake, and as well as undertaking some different trials potentially with equipment, with head postures or with body postures. All of this information, as well as then that consultation with other people involved in the care and other medical and health professionals, means that we then go away and we develop the mealtime management plan. So this is a comprehensive document that provides all the information that's needed around what the person needs to eat, how they need to eat it, and how they need to be helped with that mealtime. After developing the plan, we go back out to the person and to their care staff, and we will implement the mealtime management plan. So we'll actually go through it with them step by step, identifying all those specific parts of the mealtime management plan, describing and demonstrating the use of different strategies, showing how to make up thickened fluids, making sure that a particular diet consistency, for example, minced moist, is actually being prepared in the way in which it should. And then that's not the end of it. It's important that we review those things to make sure that the person is ongoing, is safe and on the correct diet, because it may change. Sometimes people may have a condition that means that they're deteriorating, and we need to review whether they're having more difficulties than what they were previously. So our mealtime management plans, when we provide them and implement them with the person and their care team, will provide information on positioning. So we will provide pictures, photographs, diagrams about how the person needs to sit and how they need to have their head positioned. We'll provide information on suitable equipment that we may recommend that is purchased. So it might be straws or cups. We'll think about the environmental factors and how they are impacting the person with their eating and drinking. If the person's highly distractible, might be turning off all the external noises. We might recommend specific intake strategies and prompts. We'll provide you those specific strategies and prompts. So it might be some visual prompts. It might be the use of keyword sign while eating and drinking. It might be using some set phrases with the person. We'll also provide information on the prescribed modified diet, so the food and the fluid component separately, as well as information on any medications and how they should be prepared. And we also provide information on oral hygiene, because it's an important part of mealtime management. Because if someone has food left in their mouth afterwards and their mouth gets yucky and they get bacteria, then that becomes a risk if any food, fluid or saliva is aspirated. And part of that mealtime management plan is education. So the actual mealtime management plan itself is a highly educative document, because we have all of the information around those components just mentioned. We have pictures. We will also have descriptions and explanations. So why are we recommending that you alternate someone to have some food, then some drink, some food, then some drink, as well as that process of actually running through the mealtime management plan with someone. So the purpose of it is to make it as easy as possible for the person with the swallowing difficulty to eat, so that they're not saying, like, I feel like something's stuck, that we're actually making modifications to relieve some of those symptoms. We want to reduce the risks associated with dysphagia. And as mentioned, those key risks around malnutrition, dehydration, obstruction, and aspiration. We want to try and keep the diet as normal as possible. So speech pathologists really like to work with the person and with their family around identifying what are the foods that they really enjoy, and then how can we make them a safe, modified consistency, or, changing how it's presented to make it safe. If someone does have a degenerative disease or a palliative, we want to keep them eating and drinking as long as possible, but in the safest way possible. We educate and we provide support to the person and their family around what their choices are with the mealtime management plan. And as mentioned, when someone is palliative, but also obviously in general, we want to maximise quality of life and enjoyment in eating and drinking. So the mealtime management plan is a clear medico-legal documentation. Ours are comprehensive documents and they're specifically individualised to the person. They have a fantastic educative component, and that education component very much is in fitting with what is in the NDIS standards. So these are some examples of some equipment that we might prescribe. So the cup with 2 handles is actually a cup that limits the amount of volume that you can drink at one time. The light blue cup has a cutout, so that's where your nose goes. That means you don't have to tip your head back and risk aspiration. We might also recommend some straws and different cutlery. When we're prescribing a modified diet, we will clearly identify what that diet is, describe how to prepare it, as shown in the picture. We'll provide information on what's included in that diet, what's excluded. Does it exclude bread? Does it exclude things with skins, fat, gristle, things like that? We'll also clearly identify if there's exception food. So sometimes someone may be able to eat something outside of that prescribed diet under specific preparation conditions. So we will provide photos and descriptions and information around that. We'll also talk about some special considerations, so things such as bread and things like transitional consistency. So these are things that change consistency. So go from being a solid to a liquid, and dual consistency, so where there's 2 different textures together. So in regards to the NDIS new practice standards, we're waiting for more information that's going to let providers know how they need to document their compliance. But at Recovery Station, we're really confident that we're really working with the providers and we're assisting them to provide that evidence because our mealtime management plans are so comprehensive. The great news also is that we've had some recent additions to our speech pathology team. So we actually have fantastic capacity at the moment. If you, someone you're caring for or someone you're supporting, if you're a coordinator of support, needs a mealtime management plan and a swallowing assessment, then we have great capacity for providing those. We continue to look forward to working with you and people that have swallowing difficulties, and we see these NDIS standards as a great opportunity to make sure that we're continuing to provide high quality services to someone that has a swallowing difficulty. Thank you.